Today we're going to be talking about how not all solutions come in shiny packages. When we think of innovation, we think of billion-dollar apps, we think of the latest medical technologies. But I got to learn another lesson in the most painful way. This is Mr. and Mrs. Achill, my parents. My mother passed away a year ago due to hemorrhagic stroke, and my father passed away almost 6 years ago due to diabetes complications that resulted in multi-organ failure. They traveled from St. Lucia to the United States, and they obtained access to the most innovative and advanced treatments. But by the time that they got that, it was too late. So what could have saved my parents wasn't found in a pharmacy. It was found in prevention, in 3 important facets: culture, community, and common sense. And so today, we're going to be going 150 years back in St. Lucia, where my parents are from, and also in the United States where they lived and worked. And we're going to look at what's happening today and how that can impact public health innovation moving forward. So let's start with the history of public health. Public health has a very interesting and unique starting point. But the one that really stuck to me the most is the father of epidemiology, John Snow. In 1854, he stopped the cholera outbreak in London. His great innovation that saved thousands of lives? He removed the handle from a pump to stop people from drinking contaminated water. It wasn't glamorous, but it changed history. When we look 150 years back, and look at the history of St. Lucia, we were a community that really valued vegetables. We loved dashin and plantain and green fig. These are just the vegetables on the island. But we were struggling. We had health issues that, as a community, we tried our best without the correct infrastructure in place. And that was similar in the United States as well 150 years ago. We struggled with access to clean water and infrastructure. And through public health innovation, we were able to implement sanitary sewer systems and improve infrastructure. 2 different countries, different strategies, same facet. It was public health rooted in culture, community, and common sense. So let's look at culture. Culture in St. Lucia moved today from the dashin and the plantain and all the great vegetables to more processed foods due to globalization. And unfortunately, in 2022, according to the Pan American Health Organization, 64% of St. Lucians were diagnosed or classified as overweight or obese. And 11.4% of adults aged 20 to 79 were diagnosed with diabetes. The World Bank attributed 80% of deaths in St. Lucia to heart disease, stroke, and diabetes. This isn't just statistics. These are the stories of what happened when cultural foods and identity is undervalued in the name of convenience. These are the stories of my parents. In the United States, culture is a powerful tool as well. We utilize it, but not to the best of our ability. And a generic pamphlet at the doctor's office is not going to change behavior, right? But a trusted community member embedded in an organizational and intentional program can lead to the most effective change, which we've seen in many examples. Culture is not decoration. Culture is infrastructure, and that infrastructure is community. When we look at community in St. Lucia, in times of crisis, such as a hurricane. The fishermen ferry patients to clinics. Churches open their doors to be transformed into clinics, and DJs broadcast health information in between soca songs. This isn't glamorous, but it works. According to the New England Journal of Medicine in the United States, a barbershop-based program to lower blood pressure was published. They found that in 1 year, they reduced blood pressure levels by 21 points in Black men. So we're not lacking evidence, we're lacking alignment. The solutions already live in the communities we often overlook, which leads us to common sense. When we think about rationing of treatments in St. Lucia, we make sure to do it intentionally to ensure that all patients, even though we may not have enough, is adequately and equitably shared in the population. And in the United States, common sense looks like implementing universal blood pressure screenings you may see at your local CVS, intentional diabetes health education programs, and lowering food costs and making it more affordable, healthy foods, and access to those foods. We're still working on that, but we're going in the right direction. So it's so important when we think about community and what it can do for us. And when we think about culture, and when we think about common sense. And common sense is not the absence of science. Common sense is science applied in everyday life. I'm going to give you a great example of how all three of those things is implemented right here in the United States. It's beautiful because my father's lineage as a Caribbean, his people foraged the land. They fished the seas. They mitigated health long before we called it public health. And there was a heart study done here, starting in 1984 in the United States in Native American communities, where they implemented culture, community, and common sense. This is the longest standing cohort study with over a 90% retention rate, unheard of. If anybody's in public health, we know cohort studies is very hard to keep track of and you lose a lot of people through time, but we kept it strong in these communities. So I looked at how did that happen? Culture. They made sure they were a part of the conversation and they truly respected their culture in any implementation and practice that they did. Community. They created a community in which they worked with the resources they had and didn't make them feel ashamed or did not presume that they knew the solutions of their community, which leads us to common sense. You do that, you're going to increase trust. You're going to build this relationship, which has led to very successful programs. And not only did the Native Americans act as participants, they became the scientists. They became the health educators. They pushed the program forward. They pushed the program forward. And so all of these things are so important when we think about culture, community, and common sense. So I will leave you with this. The greatest medicines in the world could not save my parents. What could have helped them was preventative actions found in hospitals, also in churches, in gardens, within their own families, within your own kitchens. And the greatest, innovative, most public health solutions are often the simplest. And not all solutions come in shiny packages. So we need to start asking, what already works? And stop asking, what's new? Because the greatest public health interventions is rooted in culture, community, and common sense. And those are also public health innovations we're spreading. Thank you.